Welcome everybody. I'll introduce this half, I think. This half, Medicine Center tonight. We have Dr. Becky Dawson from Allegheny College, who's going to be talking about Zika. Did I say it right? Zika? Okay. Zika. Dr. Dawson is involved with pretty much everything in the community. Conducted the community health needs assessment in conjunction with the hospital and all of your students, and it was probably I think it was easily the most comprehensive report that we've had in a while. So she does tons of work, excellent work. I'm excited about the presentation, so I'll let her give it a little more, a better introduction. But just two things real quick. On May 9th, we have our mindfulness eating here, and on April 25th, how to train for a 5K. So those are our next two topics coming up. All right, thank you.
Great, so thank you all for being here. Nice to be here. So as Don said, I'm Becky Dawson, and I just want to clarify that I'm not a medical doctor. I'm actually a disease detective, so I have training in epidemiology, and I love finding out about diseases and what causes them and who gets them and how we should be thinking about and prioritizing when we hear about new diseases like Zika. So that's going to be where we focus today. So the whole story about Zika that you probably have heard is when Margaret Chan, who's the head of the WHO, the World Health Organization, came on in February 1st of 2016, so about 14 months ago, and said, this Zika virus that we've known about since 1947, she called it an international global health emergency. And really her wording was very carefully chosen. She said that Zika virus and the microcephaly, which we'll talk about, the birth defects, were together was what was causing this. So it's not Zika, it's not microcephaly, but the kind of the convergence of the two things together. So this is where the story starts, from where I'm thinking about it, but we're going to go back in history and kind of track it a little bit so you get a better understanding of what's going on. So if you've paid attention or you've heard anything about Zika, you've probably seen one of two pictures. You've probably seen this one of the baby in the bucket who has microcephaly. So microcephaly is it is a very serious birth defect that causes a small skull to develop. This little guy here, his name is Jose. He was born in Brazil, and he, for better or for worse, due to the BBC, has been the poster child for the Zika virus outbreak and what it can actually do to a baby who's exposed in utero. The other picture that you probably have seen is of this pretty lady. She's our 80s Egypti mosquito. She's pretty distinct in terms of her coloring and her stripes. Most of the pictures have been pretty sensational that she's just fed, so she has her little red belly. But this is what most people have seen, and these are the two stories that the news has highlighted. So the little babies who are born with this terrible birth defect, and then this, I call it our villain, right? The bad guy in this story, this mosquito that's been spreading things. But my goal tonight is to kind of walk you through Zika at kind of a 100 level and working through it how my brain works. So not just from like diagnosis or anything, but really what is it? And then really trying to wrap this conversation up around diagnosis, testing, but really prevention and kind of some words of caution in terms of how worried we should all be about Zika or not worried in that case. So this is the Zika virus, and it is beautiful. It is an RNA virus. It's almost perfectly circle in shape. It is covered in proteins, and it's very easily transferred. And like any virus, it loves to go from host to host, and it will do whatever it can to travel from host to stay alive. And so if you can kind of stick it in your memory that that's what viruses do, they love to go from one thing to another and be very effective and infect as many people as possible to stay alive. It's going to help in our understanding of Zika as we go along. So Zika history here. So if you get to the continent of Africa, you can see that Zika was first identified in 1947, which means it's coming up on its 70th anniversary this year. So 1947, it's in the Zika virus in Uganda that they first recognized this disease. And they really didn't recognize it because of the adverse health effects, but really because of the bloodshot eyes, kind of the symptoms that people had. The microcephaly story and the story of Guillain-Barré and some of the other health effects that we're currently dealing with is not part of the 1947 narrative. But as these mosquitoes, which are super common, these are the same mosquitoes that carry dengue and yellow fever, moved around the world, literally. You can see in the 70s, it went into the Asian continent, and it kind of stayed there, and we didn't hear a lot about it. But starting in 2007 was when kind of a little bit of momentum picked up, and like if you were in the public health world or you were in the world of zoonotic diseases or diseases spread by mosquitoes, we started hearing about Zika 2008, 2009, 2010, because there was something going on kind of, as you can see in the islands off of the Asia continent. In 2013, as you can see here, what really happened was the French Polynesian islands started to see an uptick in Zika. And when we really look back at it and we'll start talking about like what are the health consequences of Zika, this is where we started seeing some of the really serious signs of some of the neurological events. So it's been in the world of people who are studying international diseases for, I don't know, we're going on about a decade now, but it really came to a head in 2014, 2015, and then obviously last summer as we saw Zika virus end up in both the South American, Latin American, and North American countries. So that's where the spread of Zika virus has, kind of taken off. And it really was the events that happened in Brazil that brought it to light to everyone last year. So in Brazil, these are the two things that came together. You got the lovely Aedes aegypti mosquito that's spreading Zika virus easily in Brazil. And if you think about Brazil, it's hot, it's humid. They have, there's a lot of poverty, and this mosquito is, sort of like a virus. He and she is able to live indoors and outdoors, both a night feeder and a day feeder. They're creative little boogers. And what happened is that you started to see this uptick in women who were pregnant, getting bitten by mosquitoes, and the adverse health effects. So this is what we're going to focus on here, is how diseases are spread. And I think that we've heard a lot about the mosquito, and that's just fine. As we talk about this mosquito, the question that always comes to my mind is how vulnerable are we here in Crawford County? And that's a good question. As you can see, this map of the United States, everything that's blue is where we know where the Aedes aegypti is, where we've seen Aedes aegypti, where Aedes aegypti has bitten people, and we know that Aedes aegypti lives. So we're close to that area at this point in time, right? It's, in all of our bordering states, except for New York. This is where, a great conversation around climate change and a really mild winter, we're going to have to see how things fall out. But I would tell you that the mosquito is close by. You only need to go to West Virginia or even southern part of Ohio to experience the Aedes aegypti. So when we talk about prevention, one of the things we're going to come back to is the map and like how we need to think about this. But just because there's the mosquito doesn't mean that disease is being transmitted there. And that's one of the lessons that I've had to learn as an epidemiologist is just because the mosquito's there doesn't mean the disease is there. And so we need to put those two things together in order for there to be real fear or a real transmission of disease. So this is where our mosquito is. But let's not forget that you can get Zika in multiple ways. It is sexually transmitted. It is also transmitted from mother to fetus, and it's also been transmitted in blood. So a couple of things. Number one, the Red Cross is screening for Zika. So there's no reason to worry about blood transfusions or any sort of event where, even a organ transplant, we are screening all of the blood and all of the organs to make sure that nobody with Zika is donating and then we're putting the blood or the organ into an individual and harming them. The mother to fetus exposure is happening obviously through the placenta and through the blood. We're still, as the public health community is trying to figure out when that fetus is most vulnerable. Is it early in development? Is it later in development? Is it right in the middle? We're still unsure about that. And as I said, it is sexually transmitted. It is heterosexual sex, homosexual sex. We have anal, oral, and vaginal sex. It's all transmitted that way. So it's one of those things when we come back to prevention, we need to think about mosquito and coming together with all of these things. So 4 routes of transmission, and we'll tell you what happens then when you get it. So when you get Zika, symptoms last like a regular virus would. It's a viral disease. So it's going to last, 2 to 7 days, and you're going to be uncomfortable. The mild headache, really the bloodshot eyes is the big one. It's kind of the one that discerns it between like a flu and another type of viral infection. There is a little bit of a skin rash that some people have seen. Joint pain is another symptom that some people experience, but not all. But the symptoms usually last for a week or so, and then for most people, you clear the virus and you're okay. The virus does live in the blood for about 2 weeks. So again, when we come back to talk about transmission, a mosquito biting someone within that 2-week period can obviously transmit disease as well. But as we're talking about symptoms, I think the more important thing to talk about is the fact that only 1 in 4 people is going to get sick. So it's not just that everyone who gets the disease will be sick, but really only 1 in 4 people will show signs or any sort of symptom of the disease, regardless of how they get it. Okay. So these are mild, right? I mean, conjunctivitis is inconvenient and it's ugly, but it's not detrimental to your health. Fever, again, is uncomfortable and you might end up staying home from work for a couple of days. Skin rash is painful, probably ugly. Joint pain, not pleasant. But again, things that you can recover from quickly and are inconveniences. But the real problem, and this is where the research world is we are all trying to get our hands around this stuff, is what are the severe health effects of Zika? So we know it causes these uncomfortable things. We also know that most people are asymptomatic, so they don't show symptoms. But we get here and we see there's really severe health consequences of Zika. These things are not common, but when they happen and they're detrimental to people's health. So we're going to go through most of these in depth, but microcephaly, congenital Zika syndrome, which is a new phrase for kind of a sort of like the autism spectrum. This is a spectrum of diseases that can happen. A mother who's pregnant can miscarry or have a stillbirth. We can have birth defects other than microcephaly, and then Guillain-Barré. So let's start with microcephaly. So as I said at the beginning, microcephaly is the disease where you're born with a shrunken skull. So not only is the skull shrunk, but the brain is shrunk as well. The development of the child is severely impaired. Some of the adverse health consequences that go with microcephaly is seizure disorders, learning disabilities, speech and cognitive development delays, are associated with these children. Their life expectancy is much lower than a regular child who's born with a fully developed skull and with a fully developed brain. A lot of kids who have microcephaly, it's not just the small size of their skull, but they actually have the collapsed skull look where the skull actually hasn't formed correctly and is not protecting the brain the way that it should. So it's a serious birth defect. It's one that is very visible too, so it's stigmatized. When you see a child with microcephaly, you know that they have it. And so again, providing services, but also trying to bring that child up to be part of society is a challenge, not only with their delays and their health consequences, but because it's a stigmatized disease. So this is one of the things. We don't know how common microcephaly is with mothers who have Zika. That's one of the big questions. Is it 1 in 4, 1 in 5? What are our risks? We don't know. It's too new. It's just one of those questions that we don't have good answers for at this point in time. So a lot of research is going on to figure out how many of these mothers who have Zika actually have babies that have microcephaly. So one of the things, again, if you think back to Margaret Chan and the announcement that this is an international public health emergency, one of her pieces of evidence was this chart. And so on the y-axis there, you can see it's the number of cases of microcephaly, and you look at it across the years. And this is data just from Brazil. Margaret Chan made her decision based on just data from Brazil. And what you can see is that over the course of, from 2010 to 2014, Brazil saw about maybe 125, 150 cases of microcephaly a year. So this was happening before Zika was circulating. We see babies here in the United States that are born with microcephaly. But in 2015, even before the year was over, that number had more than doubled. So the number of cases of microcephaly that we were seeing more than doubled. And if you break this out among the seasons, the spike in the babies that were born at the end of the summer and then into the spring was even higher. So after mosquitoes had had a chance to bite pregnant moms, then they were born the following season. So a huge spike. There's a lot of great evidence now that says, yes, Zika can cause microcephaly. So this is some of the evidence that they did to say, okay, these two things are related. So the other thing that's related to Zika is this new syndrome, right? And it's, these associated birth defects. So microcephaly is part of these, but other things that Zika can do to an unborn child if the mother has the disease is decrease in the brain tissue. With brain damage, it can cause damage to the eye. It can damage the joints, muscle tone, and the one that's not on here that's still trying to be understood, and it's going to take 4 to 5 more years, is that there's a very strong possibility that it's going to be linked with increases in autism, because the developmental pattern of these kids, follows along with some of these diseases here. So it won't be until these kids are toddlers or in, early elementary school when they can actually be diagnosed with autism that we'll see whether or not autism can be added to this list of syndromes that are associated with Zika. So the bottom line is that this Zika virus really is causing a lot of adverse health effects, especially to unborn children. And the question I probably get the most when I talk about Zika is, well, is this new? Is the virus new, or has it always been causing these things and we just didn't recognize it and put 2 and 2 together? And the short answer is I have no idea. I don't think anyone has any idea. There's a lot of hypotheses going around whether or not the virus has mutated, which viruses do by nature to stay alive and to thrive. So is it mutating and getting into our nervous system and causing the damage? Has it always done this? But if you think back to that map of where this ends, where Zika originated in Uganda and Southeast Asia and, in places that are poor where there's not as much effort into research and health records and death records, was this happening all along and we just didn't connect the 2 dots? My hypothesis is that it's probably a little bit of both. The virus has mutated as it's, evolved over 70 years, but at the same time, we don't have data from Uganda to know whether or not they were seeing these types of birth defects in 1947 as well. And they don't have death records or birth records that we can go back to and do that type of research. So I think there's some scrappy people out there trying to put these pieces together, and the story is probably going to unfold over the course of the next few years, but we may not know the true, actually what has happened over these past 70 years in as much detail as we probably all would want. This is what it does cause. We have biologic proof, we have the public health proof, and so we're gonna, keep moving on to try to figure out how do we prevent Zika, and I think the biggest story is that the vaccine is being trialed right now. So those are all the kid things, right? So all these unborn babies. But as an adult, and this is one of the things, as someone who is not pregnant, who isn't thinking about getting pregnant, why should I be worried about Zika? And yes, getting sick is uncomfortable, but I think there is a risk, there is a risk that adults, children, even people who are not, in the fetal stage, can get diseases like Guillain-Barré. So for those of you who don't know what Guillain-Barré is, it is a disease of your central nervous system where you usually see ascending paralysis, so paralysis starting in your feet and working its way up. It comes on suddenly, and most people associate it with an infection. So we see Guillain-Barré often with people who have adverse reactions to the flu vaccine or who have some sort of, very severe allergic reaction can trigger Guillain-Barré. But it's a scary disease. It's one where you start losing feeling in your feet. A lot of people do end up on a respirator. It's very similar to polio in terms of its symptoms and how it affects the body, but it's more common in adults. Very similar to polio, about a third of people who get Guillain-Barré will be permanently paralyzed. Most people will recover fully from it. But it is one of those things that we don't know a lot about how it's connected, but we do see the association between increased Zika and increased Guillain-Barré. And this was really true in the French Polynesian islands. So we have data back from 2013, 2014 that's showing us that these two things are happening together, and that there is concern for some people that they could get bit by the mosquito and then develop Guillain-Barré. So it's not just about protecting pregnant mothers. Okay, so those are the diseases. So like the next thing for me is like, oh my gosh, what do I think if I have Guillain-Barré? Or what if I think I have Zika? What's going on here? So if you think you have Zika, the first thing to do is to get tested. It seems simple, but you should. There's both a blood and a urine test, okay? So pregnant women are probably the most vulnerable here. If you're pregnant and you think you might have it, or you're worried about where you've traveled to, you should get tested. So if you live in or travel to not just areas where the Aedes aegypti are, but where CDC has said their travel notices. There's 2 travel notices going on. Actually, they're ending right now as it gets cold and as the winter has ended. But where I expect to see them is Miami-Dade County, and then again in Houston, Texas, where we've seen local transmission through mosquitoes that Zika is there. The other thing is to think about who your partner is. So if a partner has traveled to any of these areas, it's really important that you also get tested. And for women, especially if they think that they have symptoms of Guillain-Barré, or symptoms of Zika while they are pregnant, should obviously get tested. You can get tested, the health departments are testing, so all the states have the capacity to test. In addition, the Centers for Disease Control can test both blood and urine. It's actually quick and simple right now. The problem is that if you get Zika, how do you treat it? And this isn't unfortunate, but the reality is that if you get Zika, it's a virus. There's no antibiotics that you can take. There isn't even an antiviral at this point in time. So, the symptoms that are the fever, the not feeling good, the really ugly bloodshot eyes, there's nothing you can do about that, even for a pregnant woman. So we try to make sure that people are comfortable. Again, you can take, that Tylenol type of thing to make you feel better, but there's nothing that we can do to actually treat the virus itself, which means that you need to let it run its course and then, look for any adverse effects afterwards, which is scary. The big thing though, and this goes back to how it's transmitted, and this is where the story starts to kind of fall in on each other, is that 1 in 4 people only 1 in 4 people will show symptoms of the disease, that will get sick. So whether it's the severe thing or it's the not so severe thing, only 1 in 4 will do that. But the virus lives in your blood for 2 weeks. So if we're talking about transmission, if I'm here and I have the virus circulating in my blood and the mosquito bites me, it can go to somebody else and transmit the disease even if I'm feeling fine. Even if I think I've cleared the virus and my fever has broken and I'm feeling much better, it can still be transmitted. It also lives in semen for up to 6 months. So in terms of the sexual transmission, we need to all be really aware that if you do test positive, you need to think about your partners. We haven't figured out how long it lives in the vaginal fluid yet. We're still trying to research and figure that out. The other thing I would say about this 6 months, and you're gonna see my pretty slide, watch out for 6 months, is that's about how much data we have. We're not saying 6 months because we've studied this for 4 or 5 years and said we've got this and it's 6 months and we know what's gonna happen. We're saying 6 months because that's about as much data as we have. So my guess is if it is capable of living longer, is that we'll start hearing recommendations change in the upcoming years. So I think that's something to be aware of. But right now it's 2 weeks in the blood, 6 weeks in the semen. So if you do want to protect yourself, especially from the mosquito one, the recommendations coming out of the Centers for Disease Control and the WHO right now are that you should use some sort of mosquito repellent with DEET. That we really do need to prevent all types of mosquito bites from people who are living in areas that have the Aedes aegypti mosquito. So the recommendation is DEET for everyone or protective clothing. So you can wear long sleeves, boots, long socks, pants, that all works really well. But this is there. In terms of sexual contact, condoms are the only way to protect this. So obviously birth control pill, the ring, any sort of mechanism for preventing pregnancy is not going to prevent you from doing this unless there's some sort of barrier method like a condom on there. So DEET and condoms are your best bet for protecting yourself from transmitting Zika between individuals or from mosquito to individual. So what are our warnings? So the Centers for Disease Control has put out all sorts of stuff. They're really trying to target women who are having babies and trying to say, okay, here's what you should do. So they said, if you're traveling or you are thinking, you've had sex with someone without a condom who has traveled to one of these areas, you need to kind of take some precautions, okay? So a lot of it is about communication with your healthcare provider, talking about how you think you might have been exposed and when, and working through that. There are recommendations coming out from the Centers for Disease Control for women here to wait at least 8 weeks before trying to get pregnant. If you think you've been, if you've traveled to one of these areas or your partner has traveled to one of these areas. And again, there's the 6-month warning for men because it does live so long in the semen. So these warnings are new to say, hey, you should be very careful about your pregnancy plans because we have this disease and it's so tightly linked to this terrible birth defect or this series of birth defects that could, be detrimental to your child. So these are huge warnings. If you remember correctly, or if you've been paying attention, the Pope has told people to start using condoms, which is very anti-Catholic, because we don't want to see the disease spread. There are several countries in Central and South America that have told their women of childbearing age to wait up to 2 years before trying to get pregnant. So people are taking this really seriously because the adverse effects are so severe. Not because it's so common, but because it's so severe. And I think that, the fact that CDC has actually said this means that they're taking this seriously and they're very concerned about an uptick in microcephaly and adverse birth effects that are associated with the Zika virus exposure. So if you are pregnant and you are concerned, the Pennsylvania Department of Health actually has put together kits that every woman in the state of Pennsylvania is more than welcome to go and get. I think they will either mail it to you or you can go pick it up at one of the county health departments. So I think you can get them in Erie. But these kits include the things that are important. The insect repellent, 2 different kinds. The spray, right, that you can spray on your clothes and on your tent if you're going to be out in the woods. That insect repellent that you can put actually on your skin. They're providing condoms and they're also providing water, standing water tablets to kill the larvae for mosquitoes. And I think as we think about this, standing ponds and septic tank leaks and old tires, everything that we talked about during the West Nile outbreak, now 15, 16 years ago, is kind of coming to resurface again, that we need to remove the places where mosquitoes are breeding to stop the mosquitoes from being prevalent in our environment. So the Pennsylvania Department of Health is not only saying get rid of your standing water, but they're giving you treatment tablets that will just kill the larvae in any standing water that you have. So these are available to anyone who is pregnant or thinking about getting pregnant in the state of Pennsylvania to prevent Zika spread. Excellent. And the last thing I just want to talk about in terms of prevention, the things that we do need to do is that we need to prevent Zika transmission. So you can't get the disease unless you're exposed to it. You can't have the adverse effects unless you get the disease. So it's kind of like a rolling ball. We need to kind of get things upstream before they get downstream. So upstream, you want to control mosquitoes outside. That's why the Pennsylvania Department of Health is saying, hey, get rid of your water, and here are these pellets that will kill the larvae. We also need to control mosquitoes inside. And so that means making sure that you have doors, screens, that if you do go camping, you are using a tent, that there are screens in a tent, that you want to, if possible, use air conditioning instead of leaving your windows open, because we want to keep these Aedes aegypti mosquitoes, which do like to live inside. They're house mosquitoes, out of our houses, because they're not in your house, they can't bite you. The other thing, as I said, I'm going to repeat myself, wear repellent, wear repellent, wear repellent. You know, the mosquitoes aren't going to bite you if you're wearing the proper repellent. And create barriers. So these are barriers that for sexual transmission and for mosquito transmission, is that we need to keep the disease out of our own bodies. And so that's one of the things that everyone in the public health community is trying to stress, is create these barriers so that mosquitoes don't bite, you don't pass it to a sexual partner. And I will end with this, which is the World Health Organization kind of focusing on the sexual transmission piece of all of this. We are, as you know, we talk about sexually transmitted diseases, but we usually associate them with promiscuity, lots of sexual partners, infidelity, all these terrible things. This is the first time that we're really talking about a sexually transmitted disease that you can get in a monogamous relationship, because the mosquito can bite one partner and you can transmit it between a monogamous relationship. So the conversations about catching Zika through sex is really important to have, and being aware of where your partner has been and whether or not he or she has been exposed to the virus is really important. Not just if you're thinking about pregnancy, but also if you're thinking about keeping yourself healthy, because Guillain-Barré is a serious health effect, and being sick for a week has consequences as well. The other thing is that even if you and your partner are not trying to get pregnant, if you're passing the disease, you could then pass it to a mosquito that could pass it to someone else. So the snowball effect that's going on here with multiple routes of transmission makes this really difficult to control. So it's up to all of us to be thoughtful about not just our partners, but also our exposure to mosquitoes, because we as a community have the responsibility for protecting any unborn children that would exist in our community. So I think that that's the, it's a very individual decision about who you have sex with and how, and what kind of repellent you want to wear and when, and what you want to do and how you want to have your house with screens or not. But there are a lot of lessons here that, yes, those are your decisions, but we as a community have to protect each other and think about others. And this disease is spread in two very common ways, and it can go from a sexual partner to a mosquito to another person to their sexual partners, and it's convoluted. So we do need to be really, really careful, and we need to think about both routes of transmission. And with that, I would happily take any questions that you would have. Oh goodness, lots of them. Good. What?
I have a ton of questions. So is it common for global emergencies to be based off of national data?
That's a great question. So the question is whether or not a global emergency can be based off of national data. The short answer is our last two. So we've had two global health emergencies declared in the past 2 years, right? We had Ebola and then we had Zika. And Ebola was 3 countries, right? And 3 very closely related areas in those 3 countries. It was really one region, unfortunately, broken up by, lines of state, right, of the country borders. And then this one, I think that this one here, the data came out of Brazil, but the reality is that everyone looked at the mosquito and knew how far the mosquito stretch was, right? We know that Aedes aegypti exists kind of across the United States and down, and then it was just a matter of time that if we were seeing the health effects in Brazil, that we were likely to see them the other places. So I would say that there is precedent for announcing a global health emergency even when it's localized to one country.
And how has the incident rate been here?
In the United States? So we have had a lot of sexual transmission. Even in Pennsylvania, I looked today, Pennsylvania announces every Monday how many cases of Zika we have. We're at like 146 cases right now. So we have 146 people in Pennsylvania that are have tested positive for Zika. We don't have any of the adverse effects. So we haven't seen Guillain-Barré and we haven't seen any of the serious birth effects. The same thing is true. So Miami-Dade, though, is seeing a couple of cases of microcephaly. They had a lot of local transmission through both the virus and through sex. So it's really too new. Like that last year was our first season, so we're still trying to report. Some of the babies that were exposed might not have been born yet. So we're still waiting. Even if you're diagnosed in utero, we can't diagnose the disease until you become a person outside of the womb and have your own existence. So I think we're still waiting to see, but I think this summer will be a really interesting time to see how common it actually is.
So Pennsylvania has only been through sexually transmitted?
Yes.
And then what are the impacts on children?
Like a kid, like if a 5-year-old would get it. So Same as adults, right? So most kids would probably, they could easily get Guillain-Barré or some sort of neurological disease. We have no knowledge about whether or not if a 5-year-old in that developmental stage with the brain developing and the body developing, what effect that disease is going to have on that child. We just don't know. And I think that's the scary part, is that we've seen the baby thing because you have that 9-month uterus, right? Like so much happens in that 9 months and then you can see it right after those 9 months happen. But what you would see with a 5-year-old or a 6-year-old or a 7-year-old that would get the disease, we just don't know at this point. You should be able to go to your doctor or go to the emergency room or go to some hospital and ask for care. I know that last summer, both at the medical center and the ER, this is from personal experience, both the medical center and the ER and at MedExpress, that they both asked, have you traveled, to any area that you think might be Zika endemic? So had you been to South America, Latin America, or Miami? So I think that people are aware of what's going on. And usually, samples are sent to the lab. I don't know if Pennsylvania itself has capabilities, but they can send their samples to CDC in Atlanta to get tested. Excellent. Yes.
Using the repellent, what's the right way to do it? I mean,
Ooh.
So I'm you were wearing a short sleeve shirt here. So you spray it on your neck? And you
Absolutely.
And you rub it into it? What's the...
So there's instructions on the container, right, that you should, because it depends on what it is. Some are aerosolized, some are spray, some are liquid. So you should absolutely read what kind you want. It needs to contain DEET, right? So I'm not going to get an aerosol because I don't like aerosols, right? I would use the pump. But yes, so you would want to spray it on and rub it in. Think about it as sunscreen, right? You want to cover all your areas of your body. The only problem with DEET is you don't want it near your face, okay? So you're going to have to somehow be careful of your face. But mosquitoes, usually like the back of our neck, the back of our arms, those types of places. So there are some people who are claiming that they have some homeopathic, some natural types of repellents for mosquitoes. And they may work great, but this is one of those things where you don't want to get bit. You want to keep yourself safe. And I think the bigger lesson here is that mosquitoes spread a lot of diseases, right? We still have West Nile going on here. You don't have to go very far to see chikungunya. You only need to cross a couple of borders to see yellow fever, malaria. I mean, we live in a global society. I think getting to the place where you're protecting yourself from mosquitoes being a health practice, not like, oh, I don't want to get Zika, but because mosquitoes spread so many diseases, I think it's really good practice to apply repellent properly and then make sure that you're not getting bit because there's so many diseases that are spread by the mosquito.
So on the other side of that question, so
Oh, goodness.
I'm thinking of broad use of insecticides
Mm-hmm.
out there, and now honeybees, so if we eliminate mosquitoes, I mean, is there some detrimental effect to the world, by not being mosquito?
Yes, it will mess up the ecosystem, and mosquitoes are prey for somebody else, and they also are eaten by other things. So we don't want to eliminate mosquitoes. There are things, and I'm not going to tell you how I feel about this, but there are people that are trying to genetically modify mosquitoes so they can't carry disease, so that they don't bite, so that they don't draw blood. So there are people that are thinking about, can we keep the mosquito in the food chain, right, in the ecosystem, but not have them prey on us as humans and spread disease. So there are people working on that, but no, we wouldn't want to eliminate all mosquitoes. Good question. Yes?
How long does it take, if you have the virus, to develop the Guillain-Barré? Does it take a while before that shows up, or is it fast, or?
So Guillain-Barré itself strikes quickly, okay? So it's quick and ascending process. Whether or not how long it takes for you to get bit by the mosquito and then show symptoms, we don't know. The virus lasts in the blood for 2 weeks, so it has to be within that 2-week period. But how your body might react and how my body might react could be two totally things. It could happen in 24 hours, I might take a week.
It is while the virus is active.
It has to be active in your blood, yeah. Because once it's out of your blood, your body has cleared it. Semen's different. To be honest, I don't understand how it works, because we see Ebola staying there for a really long time and only transmitted through sex, but not transmitted through, you could cut someone's arm off and he wouldn't be able to transmit Ebola, but it stays in the semen for 6 months. So it does clear from right now, we're saying 2 weeks. So it has to be within that 2-week period of time. That's a great question. Any other questions?
Do you have plans to continue doing these talks to sort of educate the community?
Absolutely. I love talking about viruses. And I've spent a lot of my time, so the past year, I have spent a ton of my research time talking to women who live along the US-Mexico border and then along the Gulf states. So I've done a survey of over 2,000 women who live there of childbearing age to find out how they're processing this information and are they changing their behaviors and how has religion and their family planning structure and their partners and their marital status kind of impacted these things. So this is my livelihood. I love it. So I talk about diseases all the time. I'm happy to. Yeah, but Zika is one of those things, I think, with Ebola and then Zika being huge news events. So even though it was, as I said, it was the picture of the baby in the bucket that was there, I think everyone kind of had a working idea that there was this new virus and it was causing really bad birth defects. And the pictures all showed it's just in South America. Like our little brown babies they're being harmed. But, trying to think through, okay, we had this mosquito here and we had a lot of stuff going on in Miami-Dade. How is that impacting our understanding and how is it changing our behaviors? That's where I like to spend my time. So, absolutely. Zika is just the disease of choice right now. Yes.
So if you're advocating 2 years for women to hold on,
Right.
how does that 2-year cycle ever end if the virus continues
That's
to exist?
I don't know. So this is what CDC is telling people. So 2 years after you've been exposed is kind of how I'm reading it. So not just 2 years from today, but if you travel to Miami-Dade County where there's a lot of local transmission, that you should wait 2 years. Or if you test positive, you should wait 2 years. So I think that the guidelines have been, I think they're being overly cautious and trying to prevent, being blamed for saying you could get pregnant as soon as something happens. So I think that the biggest thing here, and I think with any health related thing, is good communication with your practitioner is really important. Being okay to ask questions when you're not sure about what's going on is really important. And then making the best decision both for you and for kind of the greater good. So thinking about that future child and not being selfish about the moment, but listening to maybe we do need to wait and make sure that the virus has cleared from both parties before we try to get pregnant again.
And I'm going to put a plug in for the hospital. We
Please.
have Dr. Reinfection, who manages travel health. So if somebody's traveling to a country they're not sure about, they can reach out to her and get more information about that country and kind of some things they can do
Absolutely.
prior to traveling.
And the CDC website has great resources as well. That's probably I would start there and then come in and talk to a physician here in town. But they have great things about where you shouldn't go, where you should go, what they're advising you to do if you need to travel, because some of us do need to travel, whether it's to visit family or for business or for a trip we can't cancel. I mean, right? There's always those situations. So they've been really wise about how do you prevent these things. There's also, Pennsylvania is giving out the packet. CDC has green bags. They're green Zika bags. They're a little bit more comprehensive with bed nets and with different types of larvicides for mosquitoes and a lot more information about the disease and how to look for it and where to go to get tested. So you can get the green bag from CDC. Do you have another question?
Does getting the virus once confer permanent immunity?
We don't know yet. That's one of the things we're trying to figure out at this point. We haven't had anyone who's been reinfected that we know of that we've been able to try to track whether or not it's working. We do know the vaccine is being trialed right now. So the FDA gave permission to the pharmaceutical companies and to the different people who are running the clinics that are running the clinical trials to expedite the virus. So the virus actually is in human trials right now. We don't have results, but it was able to kind of bypass some of the longer stages of the disease, of the vaccine development, so that we could get it out and make it available to people soon. So it will just be a little bit, but if we can do that, you would think that the body would be able to clear it as well, but that's not a given. I think we'll probably find out this summer. As somebody who had it last year will be able to be kind of that story to say, hey, I was able to avoid it, or I wasn't, and I was reinfected. Any other questions?
Thank you so much.
Thank you. You're welcome. It was great being here.